All right, everyone, thanks so much for joining us as we talk about the role of healthcare in feeding hungry children during this public health emergency. Before we get started with our expert panelists, a few housekeeping things. Again, this is Jason Gromley from Share Our Strength, and I'm really excited to be leading and moderating this panel for you all today. All of the webinar slides and recordings are going to be shared with registered attendees at the end of the summit, and then they'll be posted on our Center for Best Practices website as well. Questions will be addressed at the end of the session as time allows, and they can be posted. You can type them there in the Q&A box, and we'll address them as they come in at the end. And then if you need any technical assistance, please let us know in the comment box, and we'll get somebody to help you with any assistance you need there. So with those housekeeping things out of the way, I'm really excited with the three panelists who have agreed to present with us today. They come from a wide variety of backgrounds and areas of the country, and I think bring unique perspectives to this really important work. And so our three panelists are going to be Lynn Knox, the statewide healthcare liaison with the Oregon Food Bank; Danielle LaFleur, community outreach coordinator at St. Joseph Health System in Indiana; and Maria Welch, innovations program manager at Geisinger in Pennsylvania. So I'm going to let them each introduce themselves really quickly, just so that they have an opportunity to kind of frame out the work that they're doing in their own communities. So Lynn, can we start with you? Can you take a couple of minutes just to tell us about your organization and your role in normal times when we're not in the middle of a public health crisis?
Sure, thanks, Jason. The Oregon Food Bank is a unique organization in that it's a statewide food bank. We manage all of the 1,400 pantries in rural and urban settings across the state. And so that means that we have opportunities for synergy, standardization, and collaboration that aren't as easily available in some other states where they have very independent regional food banks. Normally, we provide about 70% of the food that gets distributed throughout the whole state from the central warehouse. And it is important to us normally that over 50% of that food be fresh produce. I'll discuss some changes we've had to make in recent times in a little bit. My role is unique, and again, also because we are a statewide food bank, it was easier for us early on to get involved in healthcare partnerships because we do have this statewide role. And I was hired 6 years ago to work with healthcare on the ground and at the state level on implementation of food insecurity screening, and then support for referrals and assistance to patients who indicated need after that. That mushroomed so quickly that we began to morph into setting up more intensive interventions at the clinic and hospital site, such as, food distributions and classes and gardens in the whole front yard of a hospital, just a wide range of interventions set up in a very community organizing style. That's what has worked here in Oregon, rather than focusing on one or two major in-depth interventions where we have a huge evaluation component with an academic institution. So it has been a very robust program until now, but pretty much everything's ground to a halt, and we'll see what emerges after the crisis is over.
Great, thanks so much, Lynn. Danielle, do you want to talk a little bit about your work at St. Joe's?
Sure. My name is Danielle LaFleur. I am the Community Outreach Coordinator for St. Joe Health System. We are an entity of Trinity Health. Like he said earlier, we're in Indiana, so in the northwest part. We have an area served of 900,000 individuals with 3 primary counties that we are specifically focused on, and that is St. Joseph County, Marshall County, and Elkhart County. I specifically live in St. Joseph County, and we're about 2 hours from Chicago. What I have been tasked to do since I got here in 2017 was conduct and implement the community health needs assessment and all of the strategies associated with that. So what a CHNA is, it's basically a survey that we have to do every 3 years to stay tax exempt. It's basically finding the community's voice. And in 2017 and 18, we conducted it and got about 4,500 surveys completed. From those surveys, we found that the community was seeking information and need in 4 main categories, and those were in numerical order: improving nutrition and eating habits, improving access to wellness resources, increasing physical activity, and then access to mental health. So those are the 4 main pillars that I work under, and from those I helped create and work with other organizations that focus in on those, and we created programs, a lot of amazing programs. And specifically from those programs, we were tasked to conduct a signature health program, and that was focusing in on specifically food insecurity. So those are kind of the 2 branches that I work under currently, normally.
Great, thanks so much, Danielle. Maria, do you want to share a little bit about your role with Geisinger and what you are normally able to accomplish for the folks in Central PA?
Absolutely. Hello, everyone. My name is Maria Welch, and I'm an Innovations Program Manager at the Geisinger Steele Institute of Innovation. Geisinger is located in Pennsylvania. It covers 45 counties in north central and northeastern Pennsylvania. We have 13 hospital campuses. We have a school of nursing, a school of medicine. We have an integrated health delivery system with over almost 600,000 members, part of it. My role on a day-to-day basis is to manage and operationalize programs that help to support social determinants of health. So examples of programs that I work on are food insecurity programs, housing, social isolation, and the integration of technology platforms to address social determinants of health.
Great, thanks so much, Maria. Now, obviously, your jobs are really intense and have a lot of different moving parts in normal circumstances. Nonprofits in healthcare, community nonprofits in healthcare, haven't always worked really closely together. They haven't always been coordinated in their approaches, especially when it comes to things like food insecurity. But all of your organizations have really been out front as that has shifted and changed. But Lynn, if I can come back to you to share with the folks, what did you do when you first realized that COVID-19 was going to have to change the way that you all approached this work? What was the first thing that you realized was going to need to change as you worked with the healthcare system in the state?
Well, I think the challenge of social distancing was the first big thing that we started grappling with. And as we started thinking about how does that affect both our packaging operations, work in the building, work in distribution, and other settings, then we began to realize that the ramifications of that and of who the initial group of priority concern around COVID was seniors, who made up 80% of our volunteers. And really, within a week's time, we lost that 80%. And so social distancing wasn't as big a concern in the work that volunteers did anymore, because there weren't hardly any. And we started seeing that whole pantries were having to close because they just had nobody there, particularly in some of the rural areas, where you had 3 people, all over 70, running a particular pantry. It was done for. And so that made us have to start rethinking, what can we accomplish in this setting? And so it's mushroomed from there, I think.
Thanks, Lynn. Maria, as you are thinking about Geisinger and like all health systems across the country is grappling with COVID and trying to figure out exactly the healthcare response. What did you all do from the food insecurity side to help either plug in with that healthcare response, or are they two kind of wholly separate entities? How are you guys coordinating or not in the communities that you serve?
That is a great question, and we rely so much on our community partners to be part of this journey with us. So even though Geisinger has programs responsive to food insecurity, for example, our fresh food pharmacy, that is a program for individuals who have type 2 diabetes and are food insecure. We couldn't do this without our community partners. We rely very much on organizations like the Central Pennsylvania Food Bank and CEO Weinberg to be our main sources of food distribution. And they are the ones who helped us to drive and kind of alter our plans to be able to deliver and disperse food out to our patients. So our first course of action was really to understand how some of the COVID responses were going to be changing our clinical operations. So at Geisinger, we have 3 food pantry locations where patients not only meet with their care team members, receive education, and also pick up food weekly to help support their care of their diabetes, as well as to reduce their food insecurity. We first had to respond how we were going to safely address those individuals who are currently in the program. And we followed all of the CDC guidelines provided, driven by our clinical teams. Educational classes were canceled, social distancing was put in place, and we adapted our food pantry models to really follow those CDC guidelines. So we transitioned to less frequent food pickup, food delivery systems, curbside delivery, order placement. So much like what's happening with a lot of our organizations, we took what was traditionally a face-to-face model and used technology as much as we could to still stay within those CDC guidelines and be able to provide food to not only our patients, but the families who we have grown very close to.
Thanks, Maria. And Danielle, as you all are, in Indiana, it hasn't been hit quite as hard as some other states, but obviously it's picking up everywhere now. So there was maybe a little bit more time in the lead up. What have you all been doing to prepare and to shift your model to address the challenges that we're seeing all over the country?
Right. So unfortunately, we have also had to suspend all of our community programs to abide by CDC guidelines. So that includes our volunteers, that includes all of our mobile food pantries that we partner with the Food Bank of Northern Indiana. So we've had to kind of shift our perspective to keep everyone as safe as possible. So our community and then also our staff. What we're doing actively is we have a COVID hotline. So if you are, the majority of people who are calling into this line are asking about symptoms and seeing where testing sites are. But if it's not an emergency, we have a non-urgent community resource hotline that is being run by all of our wonderful community health workers. And that is giving community members resources for childcare, food access, insurance, financial assistance, all of these other things that are impacting the community on a large scale because of the precautions that we're taking in the state. We are also doing curbside delivery as well. So like I said, our lovely community health workers are assisting with that. But we're also supporting our community partners. So just last week, our community health team was in the food bank, and we were boxing food for the elderly and the disabled. And we boxed, I would say, about 500 meals. And that's what we're trying to do on a daily basis, because we know our community partners in food access and food security are being hit so hard right now. And we have the time because of our programs being shifted and suspended. So we're trying to fill our time with helping our amazing partners as much as possible. But I think one of my favorite programs that we're trying to do right now is our mobile food pantry with the food bank. So in the past, we've done these large scale mobile pantries, and what they are we go into high need areas of Marshall County and St. Joseph County. And we basically set up a food bank in their neighborhood, and individuals can walk to it, come however they can. And this reduces the need of transportation, which we know is a large issue. And every time we've had a mobile pantry, we've served probably about 400 individuals at the minimum. It's gone up to probably about 800 in a single site. And what we're trying to do now is still utilize that resource, but tweak it in a way that we can have the community feel safe and the staff again feel safe. So we're trying to figure out a way to still be in the community and just help as much as we can, but using the resources that we've already designated for specific programs.
Hi, Jason, this is Lynn. Can I kind of build upon what Danielle was talking about? We as well have gone to a model, or before COVID, of really pop-up farmers markets all throughout the state, and heavily collaborating with health clinics to do that, so that people had choice. And there was an experience of the distribution that was really positive, that emphasized socialization. Well, now we're going totally in the reverse, obviously, because that's dangerous for people. But to do the boxing that people are talking about requires additional labor at a time where we've lost our labor pool. So we're still trying to figure that one out and figure out how to get the new work done and distribute the food in a way that is safe for everybody. But yes, we're looking at boxes and very not hands-on distributions, stack the boxes out in front of some place and just kind of let it go. It is not the way we want to do business, but it's the way that sometimes now we have to do business. And we are reducing, unfortunately, the amount of fresh food that's available, so that you can put it in a box and it's shelf stable, and it requires less hands-on prep than produce does to provide the shelf stable foods. But at the same time, I'm working with all the local farmers that have been running farmers markets and things like that, and we're trying to move toward a supplemental CSA system, community supported agriculture system, from the local farms. So there is continuing support for those farms and continuing produce to people that need it.
Great, thanks so much, Lynn. Danielle, coming back to you for a second here, we've talked about kind of what the immediate response is and kind of the crisis management response. As we all know, nonprofits and healthcare and all of our organizations have to plan out in advance kind of the programs and the different strategies that we want to deploy throughout the year. But COVID kind of threw all of that out the window a little bit. So are there things that you all are planning to implement over the next 2 to 3 months to kind of mitigate or to help respond with so many businesses being closed and so many, obviously the schools being out and families really struggling to get by? Are there things that you all are planning to do or innovative strategies that you want to try out over the next several months, or is that still a work in progress?
It's a little bit of both. So because COVID it feels like it's a different thing every day. New cases, new guidelines every day. It's become a little bit difficult to kind of phase out the future because we don't know what next week might look like. But we're trying to stay on target with what our strategies have been for our 3-year plan, which started in 2018. So our time frame right now is we're attempting to stay on track with a couple of our policy advocations. So we are trying to work with the food bank. Again, they are an amazing partner we have. And we're going to help create a 80-20 policy. And what that would look like is 80% of donations to the food bank would be healthy items. So things with high nutrition content, not a lot of, high sodium, high sugar. And then 20% of that would be, fun items, as we're trying to call it. So, cookies and pastries and things that may not be the best for you, because we're not trying to completely limit everyone's ability to make smart choices, but we want to help because we know that these individuals are at a very high risk for, diabetes and high blood pressure and things like that. So that is still on track. We are working with the food bank still, but again, things have kind of slowed down a bit because there are other, priorities that have taken place. We have programs that we're wanting to expand. So there is a prescription for produce program in our area, and it was focusing in on one county, and we would like to expand it to additional counties this year. And that would basically look like a voucher system if we get it up and running. And that would serve as many people in the community that would test positive for food insecurity using the Hunger Vital Sign questionnaire, which is nationally recognized. Currently, it's stalled, but we're hoping that it will pick up again and not be too off phase with COVID-19.
Great, Danielle. I think everyone on this call can understand things being the pause button being pressed on programs. So we're really excited to get moving again. So that's, I think, a response that will resonate with lots of people. Maria, the same question to you. As Geisinger continues to respond from a healthcare perspective, and you all are trying to also meet the need and address food insecurity in the communities and working with your partners. What's on the horizon for the next 2 to 3 months?
That is a great question, and I will. I'm going to touch on 2 particular programs. First of the program that I will share, one, COVID has helped us to sort of flip our thinking on it, and then the second one, I'll share a little bit more about a program that had quite a longer projection throughout 2020, and we've had to adjust that quite a bit. So the first program is, in addition to having made the adjustments to our food prescription programs at our different clinic locations, Geisinger also screens for food insecurity annually, but we've had to take that screening and adjust it, knowing that there's a lot of individuals in need based on this ever-changing climate. So we have rolled out clinically across our entire clinical enterprise, the food insecurity screenings, and all clinical providers could refer into what we had stood up as an emergency food sourcing food box program. So in addition to working with some of our key community partners in regions where we don't have a food bank, we also are providing emergency food boxes at our food prescription programs. And, you know, from what Lynn shared a little bit earlier about, you know, the challenges with getting the food prescription boxes out to different individuals, you know, making sure that we're keeping everything safe, we're keeping staff safe, we have been able to provide emergency food boxes to those in need. We have been able to redeploy and reassign staff members who might have been have their roles being shifted during this sort of crisis, be able to work in these food pantry programs, filling boxes, delivering them. And one wonderful thing that's kind of come out of this, and I say wonderful in this ever-changing environment where we've been able to work with food suppliers in our different regions who would be normally supplying food to restaurants. And with a lot of restaurants having their business models be changed or their organizations even be closed, food suppliers have had a large excess of food. So we've been able to work with them and purchase them. So in addition to be able to provide shelf-stable items through those food boxes, we've been able to provide fresh fruits and veggies through these different referral streams that we have, whether it be through our food bank providers or through the restaurant and the supply chain. So I say that with the emergency food box program, we've always talked about this delivery model system, and it's always something that's been on our horizon or our wish list. And, you know, in response to COVID, we've had to kind of flip that thinking where we had to put these things into immediate action. It's about a week and 2 days old since we went live with this emergency food box program. But so far it's been working well. Individuals could come to the clinic and pick up the food boxes, or we have team members who are going out and delivering the food boxes, not having contact with the patients, but leaving them in a safe place so that the patients could pick up the foods at their house. And one other program I do want to touch on that we've been able to help support this current climate with food insecurity and COVID is Geisinger has rolling out an initiative in partnership with our vendor and Bertha. So it is kind of a one-stop community resource network with accessible resources, community-based organizations, and really being that resource center for addressing social needs. So in partnership and very much driven by our partner Aunt Bertha, we've been able to take that platform and adjust our long-term plan. So we've been able to make that platform be responsive to COVID resources that have popped up in the community. So if somebody does need food, they can go onto that platform and they can search. And we are currently in the process of rolling that out across our entire community clinical enterprise, so that our clinical teams are at the forefront and addressing the needs of our individuals can have like a one-stop directory to go and find information that is current and accurate and get people connected to resources that are in their community that are serving the needs.
Great, thanks so much, Maria. And Lynn, you already answered this question a little bit on kind of the next 2 to 3 months on the horizon for you all, but are there any things you'd like to add on innovative programs or ideas or things that you'd really like to tackle over the next several months? And then we'll talk in a second about kind of longer term than that, but just over the next couple months, are there things that you have in the pipeline?
Well, now that we've kind of gotten past the first hump of reinventing our entire operation, one of the things that I am personally prioritizing in my role as healthcare liaison is working with healthcare organizations to funnel funds to the food bank. We have a system in Oregon where there are quite a bit of Medicaid funds that are supposed to be spent on community services. And so I take it as my job to make sure that a lot of them go to support food needs, not just the food bank, but our network of 19 food pharmacies, the CSA system we were talking about, all kinds of nutrition programming benefit from healthcare funding in normal times, and our needs are so great right now since we've already seen more than a doubling of demand from people for emergency food. We've got to have some additional funding for that, and community fundraising has been going well, and because of the established long-term now relationships I have with the regional Medicaid organizations and state healthcare organizations, we're beginning to see some real significant contributions there. But the reverse is also true in that they come to me and say, we have 55,000 high need individuals who need home deliveries. Can you provide that next week? We didn't do home deliveries basically before COVID. And so we're having to be responsive on both sides to get those funds to continue to flow, and be creative to try and use people like the unemployed restaurant workers maybe to do deliveries, and move forward into developing those new types of systems that 3 weeks ago we didn't know we needed.
Yeah, and I think that there's a lot of, just from the conversations that I've had, there's a lot of reinvention of old models to respond to the challenges that we're facing in communities all over the country right now. And so wanting to recognize and leave time for questions at the end here, I have one more set of questions for the panelists here, but want to remind all in the audience that you can feel free in the Q&A tab to ask a question that we can then address during our Q&A time. We've got a couple in here, but wanted to make sure I reminded folks, if you've got a burning question for any of our panelists, feel free to add it into the Q&A panel, and we'll get to as many of them as we can in just a minute. And so, Maria, I want to come back to you really quickly and ask, one of the things I mentioned earlier, you've got healthcare does planning over 10-year time horizons, and you look at the community health needs assessments, and they're over 3 years, and you look at all of the different ways that we're thinking long-term in healthcare about addressing the challenges in communities. And then you get a curveball like COVID, and it changes a lot. But as the crisis abates and healthcare responds and gets things under control, whether that's in a couple of months or a longer term than that, how has this, if it has, shifted your reality and your work in addressing food insecurity in the communities? Has it taught you any lessons, or has it are you hopeful you're going to be able to get back to business as usual once the crisis abates?
We hope that we get back to business as usual, and certainly with healthcare, there's always longer term projections. And one of the things that coming out of this, especially in response to all social determinants of health, is the need or the focus or the impact that these other areas have on an individual's health. With the clinical arm, there's usually a defined path. If somebody has high blood pressure, how do we get the person into a much healthier state? There's less a defined path for social determinants of health, and there's been a lot of focus within the healthcare organization on how can we address it as a whole, where is its place, what is the right path for it to take, and a lot of organizations are trying to figure out what not only works best for them, but what works best as a whole, so we can all learn together. And I think, if anything, coming out of this, it will help to spur some of that work to be able to solve for it, because it is a very large part of an individual's health. Going into it, all the different pieces of the puzzle help to keep an individual healthy, helps to keep their families healthy. And especially in times of crisis, these are the most urgent and important needs that come out and bubble up to the surface that we want to be able to address and address swiftly, but also address effectively so that we are caring for that patient, that member, or somebody in our community.
Great, thanks, Maria. And Danielle, as you think about St. Joe's and how you all plan to respond over the longer term, or how this may or may not affect your community health needs assessment process or your longer term planning, are there any things that you're going to incorporate it in there, or like Maria, are you hopeful you're going to be able to spin back to getting some of those programs and things up and running that you were looking to do before?
Yeah, we are definitely hoping to get to a normal at some point. But the thing is, if it's the new normal. So there might be significant shifts in how we view that word again. But this year is when we do our next community health needs assessment. So with COVID right now, it may shift our timing a bit, hopefully not, but we are prepared to kind of tweak our timeline and our time frame to adjust to the current situation. We have been focusing in on social determinants of health, and all of that comes around that for a while. So our shift for this shouldn't be extreme, but we just want to keep doing our due diligence and keeping boots on the ground. I think that's one thing our health system, and from what it's sounding is hers as well, is doing a great job at. So we're not one to just throw money at a situation and say, oh, we helped. We want to be critical, people, like I said, boots on the ground in these situations and these programs that we're implementing. And I think we do a beautiful job at that. So I hope that we can get back to that and show the community that we have never left them and we never would. But yeah, we just have to decide what our new normal is, if there is a new normal.
Yeah, I think we're all trying to figure out what that's going to look like in our work, and I think that was a very good way to put it. Lynn, wrapping up the kind of future case for you, you work with health insurers, with healthcare providers all across the state, and you're coming at this from the nonprofit community-based organization with the Oregon Food Bank. What's the new normal look like for you all in your planning, and how it intersects with the healthcare industry and community, and how you're hoping to continue being able to help kids and families who are in need?
Well, we've developed at the Oregon Food Bank a slogan that is future looking, of emerge stronger. We assume there will be a new normal, and we want to learn the lessons of this epidemic. And I see some hopeful signs of that in a variety of places. Last night, sitting on social media, I was thrilled to see a bunch of people who never have expressed, really political concerns or social concerns, putting out a message that said, one thing you can do right now is don't go to the grocery store between the 1st and the 3rd of the month, because all the WIC participants have totally spent all their money, and they get their checks or their vouchers at the beginning of the month, and they need what's in those stores, and you have already gotten a lot of it, so stay out. I couldn't believe that. That was such a thoughtful and smart, very personal recommendation. If we can build that level of understanding about what the lives and challenges for low-income people are, that is definitely a way to emerge stronger. little things. I now have a daily chat with some key decision makers at the Oregon Health Authority so that we can communicate about little and big problems. We've put out all kinds of fires in these morning chats where we've grown much closer in terms of understanding the challenges that each one of us have and their implications on the ground. Those relationships, that approach to problem solving collaboratively is not going to go away. So there are some real ways that we are going to all emerge stronger, I believe, out of this. And we don't know what they all are yet. And they will, I think, emerge over the next year. But we will emerge stronger.
Thanks so much, Lynn. Maria, did you have something you wanted to add as well?
Yes, absolutely. And adding on to what Danielle and Lynn shared, even from a healthcare perspective, I think they touched on that we're not in this alone. We're in this together, and this type of situation just proves that our partnerships with those around us, our community organizations that we help to serve and vice versa are so important. And it highlights the fact that, looking at it from a healthcare perspective, a healthcare organization can't do it alone. Healthcare organizations rely so heavily on their community-based partners, whether it be to support existing programs, build new programs, or all come together and stack hands during a time of crisis, which we are currently in. There is so much synergy that can be had, and in communities where maybe there is less synergy, healthcare organizations can take a very strong anchor approach and be that convener to bring people together. And maybe there's differences across communities where there may be stronger relationships than others, but helping coordinate those community convenings and bringing everyone together at the table and said, how are we going to make this better for the people around us, our communities, our employees, our patients, our members, whatever definition we might use, but it's really about working together and creating that synergy between all of us.
Thanks so much, Maria. I couldn't agree more. It's I love both the sentiments there of working together and emerging stronger. I think that's very much how we all have to be approaching this work is how can we all work together to come out of this in a better place than a lot of people are expecting right now. So before we jump into Q&A, I just want to highlight some of the work that No Kid Hungry and Share Our Strength are doing in response here. And if you've been on any of the other sessions earlier today, you'll hear a little bit more about, you've heard a little more about this, and you'll hear some more later today as well, I'm sure. But we're looking at this from an opportunity to take the great resources and talent we have internally and turn out as much information and connections as we possibly can as an organization. So as I said at the beginning, these slides will be available after the summit, and you can click through to some of these links, which I think will give you a lot of the answers to questions that I've seen pop up in the Q&A box here, but also want to highlight the grants we have available. We have been very fortunate to have a lot of our longtime supporters and new supporters step up and help in response to this crisis, and we want to make sure that we're helping organizations out there on the ground who are really working every single day to address this challenge. So make sure that if you haven't already, that you check out our application for our grants available there. And then I come at this from a government relations and advocacy perspective. And so I will add in here that Congress has passed 3 packages of aid in response to COVID. We were successful with the anti-hunger community in getting some provisions inserted into those first bills to address in the immediate aftermath of COVID, kind of wrecking our economy and taking a sledgehammer to a lot of the families that were already struggling. And so we are continuing to advocate and work with communities all across the country to make sure that when Congress passes their fourth aid package, which is in kind of production now, that includes additional support for low-income families so that they can come out of this stronger, that they can come out of this with the resources that they need to survive and to thrive, and that it's not, that COVID doesn't end up being something that really pushes low-income families even further behind as they try to emerge from this crisis. So I'm really excited about some of the questions that we've gotten because I think that they really hit the mark on some of the challenges that healthcare and nonprofit community organizations and just advocates in general are really interested in kind of tackling here. So I'm actually going to start with a little bit of a more basic one, and I'm going to toss this out to any of the panelists, but I encourage Maria and Danielle from the healthcare side to put a little bit of context around this from your perspective as well. But how does a food pharmacy work? It's something that we've seen pop up all across the country, but can you give just a little bit, a 2-minute rundown of what a food pharmacy is and how it works?
Sure. Maria, do you want to go first, or would you like me to?
Take it away.
Okay. So ours is what it sounds like. So we are working within our pediatrician's offices, and families that come in are being screened at intake and triaged by asking the 2 hunger vital signs questions. And if they say yes to either one of those or both, they are deemed as food insecure. And once that happens, they speak with a nurse, and the prescription is written out, and they take the prescription and then they collect food at a local neighborhood center. And that prescription was good for a year, and they could pick up fresh produce twice a month. And then in addition to the fresh produce that they were collecting those 2 times a month, they would also be implemented into the food pantry. So they would be technically collecting 4 times a month. And we really had a lot of energy behind that, but unfortunately it has dwindled a bit. The response from the community was not, I guess, as high as we anticipated. So we're going to tweak it a bit, and that is the program that we're going to expand upon. So instead of having individuals come to a specific site and pick up fresh fruit and vegetables there, they're going to be given vouchers. It's going to be kind of similar to what WIC does with their dollars. And we are looking for partners in the community. So, the Krogers or the Walmarts, and seeing if they would accept these vouchers from individuals who are within the program. And we're in the talks of that right now with a couple of our major players in our area. So hopefully that will get up and running, but that's basically how ours works.
Great. Maria, did you have anything to add there?
Yes, the fresh food pharmacies at Geisinger start off in a very similar fashion. We start off with the 2 USDA food insecurity questions, and all of our patients are screened annually in the rooming process, whether it be at primary care, pediatrics, or urgent care. And from there, if individuals are identified as food insecure, we get them connected to local food resources in their community. If individuals are identified as meeting the clinical criteria for our food insecurity program, the Fresh Food Pharmacy, if they have type 2 diabetes and are food insecure, and they live within a certain radius or catchment area around one of our 3 clinical food banks across at one of our clinical locations, and if they meet the enrollment criteria, they are enrolled in the Fresh Food Pharmacy. We have food banks at the clinical locations, and individuals come in and they pick up weekly food. We provide enough of food for themselves and their entire family, so 10 meals per week. And during that time, they meet regularly with a registered dietitian, a registered nurse. We have a community health assistant. At these locations, we have educational programs around diabetes and other important educational topics. We have a full-time pantry manager that runs the entire organization. And through there, we have this kind of wraparound service because type 2 diabetes is incredibly responsive to lifestyle changes, specifically diet and exercise. And we want to help our patients live healthier lifestyles and get that fresh fruits and vegetables, lean proteins, whole grains, dairy products. So everything that is in the pantry has been approved by our registered dietitians to be healthy for individuals with type 2 diabetes. We provide recipes for them to try different items, and individuals oftentimes come back whether they're incredibly unsure about certain fruits or vegetables, and we get a wonderful response that people are trying new fruits and vegetables. They value the education, whether it be through our care team or through our educational classes. And not only does the patient benefit from the program, but their entire family also benefits from the program. And we hear stories all the time of individuals sharing how they love strawberries or apples, and their grandkids now ask for them weekly because they found that they love them so much and they're replacing unhealthier options in the house.
That's wonderful. The next question is, I want to throw this out to all three of you, but Lynn, if I can start with you as somebody who's working with a lot of different healthcare folks, but where do the funds come from to run these programs, to purchase these additional fruits and vegetables, to run these kinds of programs that are helping communities all across your states?
The funding comes from, a hodgepodge of things that we can put together. There are some conventional foundations that support these programs. There are hospital community benefit funds, since almost every single one of our 100 hospitals in Oregon are nonprofit. They have to follow IRS guidelines about putting back some of their profits into the community. We have a state Medicaid system that provides funds to the regional Medicaid organizations for exactly these purposes of addressing social needs. So it's a wide range of places that we get the funds. It can be challenging to get them. It is not something that they're fully used to supporting yet. And sometimes the funding, as with most grant type funding, comes and goes. And that makes program administration difficult. But we also are working on the fresh produce aspect. We have such a robust local farm economy all over Oregon that the state agriculture department is also a place, and the U.S. Department of Agriculture, that we have gone to for funding for some of these programs. So it's really broad.
Great, thanks, Lynn. Danielle or Maria?
Sure. We have a foundation here at the hospital, so it's the foundation of St. Joe Health System. We also use community benefit dollars. Within my department, which is community health and well-being, we have a specific budget to do all of our community resources. And then from the community health needs assessment, we created a 3-year budget around all of the programs and partnerships that we determined we were going to focus in on during that 3-year time. So we have money pooled from a bunch of places, but we also need additional funds from grants and other things, because it's sometimes difficult to really map out how much one program can cost, and then our our problem is we want to help as many people as possible. So we think that it's going to be X amount of people in this program, but then we get to that number and we're like, okay, well, we need to expand it. We need to help more. So that requires additional dollars. So we're always seeking out outside resources and specifically community partnerships. So it is, you know, in-kind donations, but it definitely comes from multiple areas.
Maria, anything to add there?
I'll echo what Danielle said. Our programs are currently supported by grants, philanthropy, donations, and as well as in-kind donations from a staffing perspective. And, you know, there's always the look towards the future for any programs like this. You know, how else can we help individuals? You know, for our programs, you know, how can we expand out to prove the same concept with other disease states that are also very responsive from a lifestyle change, diet and exercise, and always looking for those future opportunities as well as our partners. I mean, we certainly could not do this without our partners at the Central Pennsylvania Food Bank and the CEO Weinberg. They do provide, you know, up to 80% of our food distribution and our food sourcing for all of our food pantry locations. And we certainly couldn't do this work, this great work, without them being the backbone for not only the food supplier, but being in partnership with us every step of the way to help and reinvent and constantly change and expand the program, whether it be due to current situations or even a long-term projection of a program when things are back to normal or whatever that new normal is.
Great. I would just like to thank you all so very much for spending some time with us, both agreeing originally to join us in person and to shifting to a mobile format and calling us from your own homes in many cases to both be panelists, but also to listen in and gain some insight from these folks who are on the front lines every single day. So thank you all so much. I know that the next session starts promptly at 2:15, so I don't want to keep anyone any longer than that, but just thank you all for your time. And we have way more questions than we were able to answer, and we'll do our best to get you guys answers as quickly as we can.